Have you ever wondered what really goes through a doctor's mind when you step into their office? It's not something most people like to think about. But the truth is, behind the polite smiles and professional words, some doctors carry certain unspoken beliefs about older patients, beliefs that can quietly shape the kind of care you get. These thoughts aren't always flattering, and they're rarely spoken out loud. Yet they can decide how seriously your symptoms are taken, how your treatment is planned, and even which options you're offered. In this video, we're uncovering 5 eye-opening truths about what many doctors actually think about older people. And knowing these truths is the first step to making sure you get the respect, attention, and care you truly deserve. Stick with me until the very end, because the last truth might completely change how you approach your next doctor's appointment. Truth number 1, they often assume your symptoms are just old age. One of the most frustrating experiences older adults face is hearing their symptoms brushed off as simply part of getting older. You might visit your doctor for joint pain, fatigue, or memory changes, and instead of looking deeper, you hear something like, "Well, that's normal at your age." Yes, aging naturally brings changes, but this assumption can be dangerous. It can lead to misdiagnoses and delayed treatments for conditions that are not only real, but treatable. That shortness of breath you're feeling? It might be dismissed as slowing down, when in reality it could be an early sign of heart disease. Occasional forgetfulness? It could be blamed on senior moments, when it might actually be linked to a medication side effect or a thyroid issue, both of which can be fixed. Often, this mindset isn't intentional harm. Doctors work under heavy time pressure, and when they hear a familiar complaint from an older patient, they might jump to the simplest explanation. But simple doesn't always mean correct. Conditions like depression, vitamin deficiencies, or even early-stage cancers have been overlooked because of this shortcut thinking, leaving patients to suffer far longer than necessary. Take Robert, an 82-year-old man I once knew. He began feeling extremely tired and dizzy. His doctor told him it was just part of aging and advised him to rest more. Months later, after Robert pushed for further tests, they found he had a heart valve problem. Once it was treated, his energy returned, and he often said he wished someone had taken his first complaint seriously. The lesson here? Never let age be the final explanation for your health changes. A persistent cough, sudden weight loss, or a shift in your mobility deserves careful investigation, no matter how many birthdays you've had. When doctors look beyond age-based assumptions, they often find problems that, once addressed, can dramatically improve both quality of life and lifespan. As a patient, you have every right to speak up, ask questions, and make it clear that you're looking for answers, not just reassurance that this is normal for your age. You deserve the same careful attention and investigative effort that would be given to someone decades younger. Your health is just as valuable at 80 as it was at 40. Truth number 2, they may believe older patients are less likely to follow treatment plans. Another quiet belief some doctors hold is that older patients won't, or can't, stick to medical instructions as well as younger ones. This idea can come from stereotypes, past experiences, or even unconscious bias. If a doctor assumes you'll have trouble keeping up with a plan, they might oversimplify your treatment or avoid offering more advanced options altogether. The intention might be to make things easier for you, but it can also mean you get less thorough care than you deserve. Often, these assumptions are tied to concerns about memory, hearing, or the ability to manage multiple medications. A doctor might think, if I give too many steps, they'll forget, or this treatment will be too complicated. Yes, some older adults do face these challenges, but it's a mistake to believe it applies to everyone. Many people in their 70s and 80s can follow complex instructions, keep detailed medication schedules, and even research their own health conditions to make informed choices. When a doctor withholds information or skips explaining all the options, you miss the chance to make decisions that could significantly improve your health. For example, a specialist might avoid discussing a cutting-edge arthritis therapy because they assume you wouldn't want to manage the extra steps, even if you'd be willing and capable. Or they might fail to explain how lifestyle changes could work alongside medication to better control your blood pressure. In both cases, you're left without the full picture, and that means missing out on the best possible care. I once met a woman named Carol who was 79 when she was diagnosed with a heart condition. Her first cardiologist gave her a very basic plan, assuming she wouldn't want anything too demanding. But Carol wanted to be proactive. When she switched to a new doctor, he explained every available option, from medication combinations to diet adjustments and exercise routines. With that detailed plan, Carol managed her condition far better than before. This is why it's so important to show your doctor that you're engaged and ready to be an active partner in your care. Bring a notebook to appointments, ask for written instructions, and speak up if something is unclear. By proving you can and will follow through, you help break down the assumption that older patients can't handle more involved treatment plans. In the end, following a treatment plan isn't about age, it's about willingness, support, and clear communication. And when doctors see your commitment, they're far more likely to share every option, giving you the best chance at long-term health and quality of life. If you're still watching and finding these insights helpful, comment number 2 below so I know you're with me. And if you haven't subscribed yet, take a moment to do that and turn on the bell, so you never miss our latest health and wellness tips. Your support helps us keep creating content that informs and inspires. Truth number 3, they may prioritize younger patients in certain situations. It's uncomfortable to admit, but in some cases, doctors unconsciously give more attention or priority to younger patients, especially when time and resources are limited. This bias doesn't always come from disregard, sometimes it's rooted in the belief that younger people have more years ahead and therefore more to gain from aggressive treatment. The problem is, this thinking can mean that older adults receive less urgency, fewer follow-ups, or are overlooked for procedures that could still bring tremendous benefits. In busy clinics or hospitals, when a physician is juggling many patients, they might instinctively devote more time to someone 20 or 30 years younger, assuming the long-term payoff will be greater. But here's the truth, quality of life matters at every age. A 75-year-old deserves the same chance to feel strong, capable, and pain-free as someone who's 40. Prioritizing by age alone ignores how much a well-timed treatment can mean for independence, dignity, and daily joy. This bias can sneak into decisions about testing or surgery. An older patient might be told a certain test isn't necessary because symptoms are probably just aging, while a younger patient with the exact same symptoms would be tested immediately. Or a doctor might avoid suggesting surgery because they assume recovery will be too hard, without ever asking if the patient is willing to take on that challenge. I remember a man named Richard, 82 years old, who struggled with severe knee pain. His first doctor dismissed the idea of knee replacement, saying it was too much for his age. But Richard was active, healthy, and eager to stay that way. When he sought a second opinion, the new surgeon evaluated him based on his health, not his birth year. Richard had the surgery, recovered well, and returned to the daily walks he had missed for years. The takeaway? Age should be just one factor in medical decisions, not the deciding factor. Your overall health, mindset, and personal goals matter just as much. If you ever feel your needs are being pushed aside in favor of younger patients, speak up or seek another opinion. Remind your doctor that your time, comfort, and future are valuable. This shifts the focus from how long will they live to how well can they live. And that change can make all the difference. Truth number 4, they may see your life goals as less important. Another hidden truth is that some doctors, often without realizing it, make assumptions about what matters to older patients. They may believe that by the time you reach your 70s or 80s, your main priorities are comfort and basic health maintenance, rather than pursuing big goals, hobbies, or new experiences. This mindset can quietly shape the kind of advice and treatment you're offered. If a doctor assumes your only aim is to get by, they might overlook opportunities to help you stay active, travel, or enjoy the activities you love most. For example, you might mention knee pain, and instead of discussing surgery or physical therapy to help you return to hiking, dancing, or gardening, they focus only on pain medication. Or they might recommend the quickest, easiest treatment rather than exploring more proactive approaches, simply assuming you wouldn't want to put in extra effort for a bigger payoff later. But this thinking can be incredibly limiting, especially if you still have vibrant goals for your future. I knew a woman named Ellen, 81 years old, who dreamed of visiting her granddaughter overseas. She had a chronic lung condition, and her first doctor suggested she focus on staying comfortable at home. But Ellen wanted more than comfort, she wanted to feel well enough to make that trip. When she switched to a new physician, he listened to her goal and created a plan, targeted exercise, updated medications, and strategies to prepare for travel. 6 months later, she made the journey, and she said it was one of the happiest moments of her life. The lesson here is simple: your goals matter, no matter your age. Whether you want to keep gardening, join a club, or take a special trip, your medical care should support those ambitions. If your doctor doesn't ask about your life beyond basic health, bring it up yourself. Share what you hope to achieve and ask how your treatment can help you get there. When doctors see you as a whole person with dreams, not just a patient to keep stable, they can shape your care in ways that make life richer, not just longer. If you're still watching and finding these insights helpful, comment number 4 below so I know you're here. And if you haven't subscribed yet, make sure to do that and turn on the bell, so you never miss our latest videos. Your support helps us keep creating content to inform and inspire you. Truth number 5, they may underestimate the emotional impact of aging on health. Many doctors focus heavily on physical symptoms, but some overlook just how much emotional well-being shapes overall health, especially for older adults. Aging isn't just about joints, blood pressure, and lab results. It's also about adapting to losses, changes in identity, and sometimes living with reduced independence. When the emotional side is brushed aside, treatment plans can feel incomplete and leave important needs unmet. Too often, sadness, anxiety, or withdrawal get labeled as just part of getting older, rather than being seen as issues that can, and should, be addressed. Doctors may skip asking about loneliness, grief, or fears about the future simply because it's not part of the standard checklist. But these emotional factors have a direct effect on physical health, impacting sleep, appetite, immune function, and even how well your body recovers from illness. I once spoke with a man named Leonard who lost his wife of 54 years. Soon after, his health began to decline rapidly. Each doctor visit focused only on adjusting medications. No one asked how he was coping or whether he had support at home. It wasn't until a neighbor encouraged him to try counseling that things began to change. Addressing the emotional weight he was carrying didn't just lift his spirits, it improved his physical health too. His prescriptions stayed the same, but his energy and resilience returned because someone finally helped him heal emotionally as well as physically. Emotional struggles in older adults can be harder to spot, especially if you don't speak up. A doctor might think you're fine because you answer, "I'm okay," when they ask how you're doing. That's why it's so important to share what's really going on, even if it feels unrelated to your medical condition. Telling your doctor that you've been feeling down, stressed, or lonely isn't complaining, it's giving them the full picture they need to truly help you. When the emotional side of aging is ignored, patients can feel unseen and unsupported, and that can quietly slow physical recovery. But when it's acknowledged and addressed, it can lead to better health outcomes, more energy, and a stronger sense of purpose. A good doctor understands that treating you as a whole person means caring for both your body and your mind. Sometimes, a single honest conversation about how you're feeling can be just as important as any prescription. Final thoughts. Hearing these 5 truths can stir up a lot of emotions. Some of you might be nodding because you've lived these experiences, while others may feel frustrated, or even hurt. But the goal here isn't to paint all doctors with the same brush or make you lose trust in them. It's to remind you that your health, dignity, and well-being deserve to be fully seen, respected, and cared for at every stage of life. Knowing these realities gives you the power to walk into appointments with more confidence, ask the right questions, and make sure your voice is heard. Aging does not make you less important. In fact, the wisdom, resilience, and life experience you carry are things no medical test can measure, but they are deeply valuable. You have the right to expect care that treats you as a whole person, not just a birth date on a chart or a list of symptoms. And if you ever feel overlooked or dismissed, don't see it as a reason to give up, see it as a reason to speak up, seek a second opinion, or find a healthcare provider who values you for the unique individual you are. The best outcomes in medicine happen when patients and doctors work as a team. That means being honest about your concerns, asking for clear explanations, and remembering that you are an active participant in your care, not just a passive recipient. When you approach your health with that mindset, you're far more likely to get the respect, attention, and thorough care you deserve. So as you move forward, carry this knowledge with you. Use it to build stronger, more respectful relationships with those who care for your health. And never forget, your life, your story, and your well-being matter just as much now as they did decades ago. Thank you for joining us today. I'd love to hear from you. Share one thing you learned from this video and how you plan to apply it in your life. Your thoughts inspire us and keep this community strong. If you found this video helpful, please like, subscribe, and share. Your support helps us continue creating content to inform and inspire you. Thanks for watching, and I look forward to seeing you in the next video.